Yeah, that's ridiculous. That's crazy. Imagine putting that at nighttime. Well, I'm going to go to bed at nighttime. Where you're going to wake up and your sheets are going to be all like ruined. What, you can do laundry every night? What's the point of it though, right? Aside from a 10 or 15 second clip on your social media. Will you get the same results as kind of what they're talking about? Probably not.
Do you go on TikTok a lot?
No, I don't.
Do your kids?
I'm sure they do.
I scour TikTok pretty often every day, like endlessly, I would say. And there's a lot of strange things that come up. So today, we're gonna show you some of those strange beauty trends.
Okay.
And I just want you to give your overall take and if these work. So this first one is microneedling at home. Do you have an overall opinion of doing it at home first?
I think it's fine.
Okay.
Yeah.
So this is using a brand called Cure.
I can't believe I'm doing this, but I'm going to be trying microneedling at home today using the Cure Micro Infusion System. I am so nervous, but here goes.
Real skin check. I have some things right here. I have some texture right here. And today we're treating it, okay?
It comes with a unique 2-in-1 system that will stamp your skin with 24 karat gold, and the needle is 0.5 millimeters. You basically get the benefits of microneedling while adding an infusion of serum. In this case, I am adding a rejuvenating serum, which will brighten an even skin tone while boosting hydration on my face. I know you're probably concerned about the pain because I really was too. If I had to rate the pain level, it would be a 2 out of 10 of it not being painful at all. It just feels like a tiny pinch. And y'all, I have read a lot of negative reviews about at-home microneedling devices, but this one is backed by a lot of dermatologists, so that's why I decided to give it a try. Also, here's a screenshot of how I poked myself, but in 5 minutes I was done. My face wasn't that irritated and I'm happy.
Have you heard of this device before?
No, but there's many devices out there very similar to that.
Oh, that do the exact same thing. Okay. I think there's one more.
My microneedling routine. Pull hair away. Double cleanse. Numbing cream. Apply the Fembi Hyaluronic Acid Serum. It lubricates the skin, preventing the microneedle from dragging the skin. Start needling using circular motions. Cleanse and apply the serum again to calm and hydrate the skin. Fab.
So I feel like I've seen a lot of different ways to do microneedling, and I'm not that familiar with it.
Yeah. So you showed 2 videos of at-home microneedling systems. The first is kind of like a stamping infusion system, and the second was a standard, more traditional electronic microneedling system, right? I think you know, things that you want to take into consideration. One is sterility. You want to make sure it's clean. You want to make sure your needles that are using, one again, are sterile, and that your face is clean before you start the procedure. The last thing you want to do is create an infection or create a side effect in terms of, you know, you wanting to improve something like your complexion or acne scarring, et cetera, right? Other things to take into consideration are basically the depth that you're actually microneedling at, because that can make a big difference. I mean, if you're looking at just general complexion, sure, staying at a shallower depth is recommended. Whereas if you have scarring, I think the second video, it almost looked like the female actually had some acne scarring or long-term old scars. Typically those you need to get deeper down, and a lot of the home devices don't actually go down deep enough, right? In addition to that, it's not like the holy grail of things, right? You also need to take into consideration, is it totally indicated for what you're trying to achieve, right? So whereas if you have like deep pitting scars, is home microneedling going to be able to reverse that? Maybe to some extent, but it's not going to get rid of it. You're going to have to use different other types of modalities or different types of microneedling devices, pairing it with some type of energy to really get you the results.
So how often should I be doing that if I bought one of those machines? Is it an everyday thing?
I think with home microneedling, you're going to see gains up until a certain point, right? So if you're doing it, you know, if you did it once a week versus every day, will you see 7 times the results? Probably not, right? And that's actually overkill. So I think a good regimen would probably be like a weekly routine, but it all depends on certain things. You know, what condition you have, how old you are, you know, because that'll basically help determine the response and the response rate that you get from the device. Also, what type of microneedling device are you using, right? So are you using like a stamping infusion system versus a kind of electronic microneedling, right? And it also depends on how aggressive you are. So these are a lot of factors that we can't really control, and from a physician standpoint. So my big takeaway would be to everything in moderation.
Is there one form of microneedling that's better than the other? Like, which of those two would you recommend?
I guess comparing the two different methods, one is the stamping and infusion versus the just standard microneedling. It's almost doing the same thing, it's just a different process, right? The second process, or the second version, is a standard microneedling device, but typically you would use some type of glide, right, or some type of solution. So instead of stamping and infusing, you're almost doing the same thing. You're probably creating more microchannels by using that pen device and then topically applying whatever solution you are to help kind of penetrate and absorb down into those microchannels.
This next one's a little gross, I'm not gonna lie, but it's called slugging. Have you heard of this before?
Mm-mm.
So I guess the purpose of slugging is to make your face super moisturized by applying a bunch of Aquaphor or Vaseline. So this one disturbed me when I watched it.
Oh my goodness. Let's get glam, y'all. Ooh, I'm just kidding, y'all. But I'm gonna show you my favorite makeup hacks using the regular old Vaseline Healing Jelly. Sponsored by Vaseline. I'm just taking a little dollop, putting it on the back of my hand, in this nice little burnt orange lipstick, and we're gonna create the most beautiful luminous blush ever. Then you just gotta mix them together. Literally, look at how beautiful this looks. All right, let's put it on the cheeks. And we're going in and blending that out. Look at how beautiful and luminous this looks. I'm gonna put it right over the nose too. I'm gonna put
let's do this one.
Are we still talking about slugging? Slugging refers to the new trend of applying petroleum jelly all over the face at the completion of your skincare routine. You only need to use a pea-sized amount. Petroleum jelly is an occlusive. An occlusive is a product or ingredient that prevents the evaporation of water from the skin, also increases the efficacy of products used underneath, and protects the skin from some environmental stress. Slugging is best done during your nighttime routine and in cold, dry weather for normal, dry, combo skin. For a lighter option during the day, use facial oils. If you have acne, milia, or oily skin, just use a facial oil or moisturizer.
Okay. What do you think of this?
I'm sorry, but that's like the stupidest thing, right? I mean, so if you undergo a procedure and you want something occlusive, sure, you can use Vaseline, but it really depends on what type of thing that you use to slug with, right? So Vaseline doesn't really absorb into your skin. It just creates a barrier, right? It's just, I think it's unbelievably messy. Imagine putting that at nighttime. Well, I'm gonna go to bed at nighttime, where you're gonna wake up and your sheets are gonna be all like ruined. What, you can do laundry every night? That's crazy, right? You're better off just having a good hydrating moisturizer, right, at nighttime. And that's typically what a lot of moisturizers do. And a lot of moisturizers actually come infused with hyaluronic acid, right? What does that do? It absorbs water. So if you can get that to infuse into your skin and absorb water, you're kind of doing the same thing, right? Not to mention, like, how are you going to clean that up, right? That's so messy. So I don't know. If it works for you, great. I personally wouldn't do it or recommend it to any of my patients.
Is there a possibility that like this could clog your pores instead?
There's a possibility it could clog. So again, it depends on what type of thing, I don't know, cream or thing that you're using, right? So if you're using Vaseline, which is occlusive, versus like Aquaphor. Aquaphor, what? It's water-based, so it actually absorbs, right? So it's great for hydrating, right? But to put it on to that extent where it's like just slugged on and it's lathered, versus, oh, I have a thin film, you're probably gonna get the same effect, right? It's probably much easier to clean up as well, but it's kind of extreme.
I think there was a dermatologist that reacted to this, so
Yeah.
let me see.
Yeah, that's ridiculous. That's crazy.
If you don't know what slugging is, it's when you apply a petroleum-based product at night as the last step of your skincare routine to reduce the amount of water that your skin is losing to the environment. Think glass skin unlocked. So how much Aquaphor do you need to slug? Because let me tell you now, it is not this much. You need about a pea-sized amount. Like literally, this is it. That is all you need. You don't need to be basted in it. A little bit goes a really long way. Okay, so a few things when it comes to slugging.
I mean, you just on top of that, I mean, if you were to incorporate, microneedling or radiofrequency microneedling or some type of modality or energy-based device, you can, in essence, increase the thickness of your epidermis, right? So clinical studies have shown that by incorporating some of these types of modalities along with certain special types of serums, you can actually reduce the transepidermal water loss. So basically make it so that your skin retains and holds the moisture. But again, reacting to that, yeah, kind of like what we talked about, you only need a very, very fine layer. Caking it on isn't going to give you a better effect.
So this next one's a little weird. There's a hashtag called lookmaxing, and it's pretty much guys doing strange things to their face to get a more like masculine look. So I believe this one's mewing. Which have you heard of before?
Yeah, my kids do it.
Oh really?
How to do mewing the right way. Ideally, your entire tongue is up on your palate at all times. The tip of your tongue should be just behind your front teeth, and the middle and back thirds of your tongue should also be up on your palate. Now, you don't want to have to force your tongue up there too hard. This should be a light suction hold. It's like a vacuum suction on your upper palate where there's no air between your tongue and your upper palate. The outside of your tongue should be resting on what's called the alveolar ridge, just above your teeth and just above your molar. Your tongue is never touching your teeth when at rest, and this is very, very important. Now, your lips and teeth should be gently touching without a lot of strain or effort, and you should ideally be breathing through your nose. Now, this is easier said than done. In my experience, a lot of people cannot maintain this correct tongue position through just mewing alone. So if you want to learn how to maintain this correct resting position without having to try or think about it all day, be sure to follow me and I will be posting videos about it.
Okay, so mewing, does it work or no?
Mewing doesn't work. Well, what's the point of it though, right? Aside from a 10 or 15 second clip on your social media, ultimately it doesn't do anything in the long run. But yeah, I guess hypothetically it could work. It could make your jawline look, more snatched. But again, are there any like long-term beneficial effects of it? Probably not, right? You're not doing it enough to actually elicit any changes to the structure of your lower face.
So it would not give me a permanent jawline?
Depends how long you can hold it, right?
I started doing it when I was 19 for like 2 years because I really believed it would work.
Yeah, you could probably use your time a little better, but yeah, it's okay.
Okay, this next one.
I'm chewing hard gum every day for 30 days to see if I actually grow my jaw muscles and help me achieve a better facial structure. Day 1, I started off with the 10 times harder jawliner gum. This isn't just your average chewing gum, this is a jawline sculptor in disguise. 5 minutes of me chewing this, my jaw is already sore. On days 1 through 10, I chewed and chewed and chewed. I chewed in the gym, I chewed when working, I chewed anywhere I was at, I was always chewing my gum. And I could definitely tell by just a few days in what was really happening.
That's it.
Yeah. So I mean, chewing this hard gum to create more definition in the posterior aspect of your jawline, right? Especially with guys, we equate masculinity with kind of squaring off of the jawline, right? And a lot of times we use fillers or things like that to help accentuate the actual jawline and make it sharper, right? So in terms of chewing gum, basically what are you doing? You're basically activating probably one of the biggest muscles in your actual jaw, the masseter muscle, right? This is the muscle that's responsible for chewing down. Some people who actually have a problem with grinding their teeth, what you'll do, you'll actually introduce some toxin or neurotoxin into the masseter to help calm that down because you don't want it overactive. But the intent here is to chew on something. I don't know if you've seen it, but there's another device out there. It's like this little ball thing that you stick in your mouth and you're like, chew. What are you doing? You're just activating these muscles and building those up to make it look more square and more masculine. So hypothetically, yes, it could work. It probably does. I've never used it, but you're going to end up with a sore jaw, and you can end up with other bad effects or just side effects. It could probably cause misalignment of your jaw if one side is stronger than the other. So it can actually kind of screw up your bite in a way You know, and that's unintended, obviously.
What's the best way to get a jawline then?
The best way to get a jawline? Well, I mean, there's different types of things you can do, right? I mean, if you are looking for, if your whole jawline in particular, right? A lot of times it's caused by too much tissue, right? So a lot of times you can improve the enhancement of the jawline by 1, like losing weight, right? 2, getting rid of extra tissue, right? Or 3, you can alter the appearance of your jawline by using different types of injectables like fillers, right along the jawline or the posterior jawline to make it look longer, right? And that's something that you can do, yeah.
Okay, I think this one has to do with the eyes. God, sorry. Okay, so do you think that like constant pulling can create some sort of effect in like the eyebrow or eyes? I'm not too sure like what they're trying to do, but when I was looking at it, it kind of seemed like they were trying to recreate like a PDO thread.
Yeah, so this negative canthal tilt, what you're basically doing, you're stretching or you're pulling. You want to get like that cat eye effect, right? So temporarily it can't do that because you may alter some of the muscles or the stimulation in those muscles there to kind of give you like an upward tilt, right, or like a lift, right? But how long does that really last? Probably not very long, maybe on the order of seconds to maybe minutes. So it's not something where like you're gonna wake up and your routine is for 5 minutes. You're gonna be doing this in the morning, and the rest of the day you can have this like cat eye like effect. Probably not. It's very short lived.
So don't do it.
If it works for you, I mean, if you want to be walking around all day, I can walk around all day too with just my hands like this, right? And you know, my brows are lifted.
It's like me with a headache.
Yeah.
Just pulling it back.
Yeah.
Maxine. People all over the internet are saying that eating carrots once a day will give you amazing benefits. I actually did my own research on this and it actually says that there are some benefits. Eating real raw carrots once a day will give you a good tan. These people right here are kind of living proof that carrot maxing actually kind of works. Carrots have also been shown to have face slimming effects. And you guys, I'm not one of your corny looks maxers. This stuff actually kind of works. People are also saying that they've seen changes in at least 2 weeks. So if you want to start carrot maxing, it's really not that hard. Just 1 carrot a day. Don't mind my voice. Me and my friend were just freaking screaming our throats out to hardstyle.
Okay.
Yeah, Amy. Okay, so this is one of the, you know, kind of dangerous things about social media, right? And a lot of times social media and marketing in general, it preys on our insecurities, right? Like, who doesn't want to have better complexion? Who doesn't want to have a natural tan, right? Who doesn't want like more slimming of their face? And if you think you can achieve it by eating a carrot a day, go right on ahead. You know, I don't think that's actually going to work, right? So it's one of these things where, sure, I don't think it hurts, right? The nutritional benefits of eating a carrot a day. Will you get the same results as kind of what they're talking about? Probably not, but you know, I invite you to prove me wrong.
Okay, cool. I didn't think that one worked either. There is one that was super strange. It might be this. Okay, so the concept of this one, I had to get someone to explain this to me, but you're trying to, I don't know if it's like fracture or move something out of place so that the bone can restructure itself in a new position, giving you like better cheekbones, a sharper jawline.
Yeah. The only way I can explain this, so basically the guy is taking a hammer to his face, and basically he already has good bone structure, by the way. So I mean, even without this, he could be using a feather on his face, and you're still going to probably see, you know, good results. But he goes along his zygomatic arch right along here, which is like the big kind of bone that sits underneath your cheeks, right? And then he goes right here on the chin. A couple things by adding any type of trauma, right? You don't need to use a hammer. You could use anything. You could hit yourself with the bottle of water along here, right? And what are you going to do? In the short term, you're going to cause some inflammation, right? So it's almost like, oh, I'm kind of punching myself in the face. Just specific areas to cause a little more definition, right? A little more volume, sure. Two, if you're trying to remodel bone by doing that, I think that's a really hard sell. If you look at kind of bone physiology, kind of osteoclast and osteoblast activity, sure, that's kind of how braces work, right? You're realigning your teeth and they kind of grow in a certain way. But that's something where you need constant pressure, right, to be able to do that. Not doing this for a couple seconds or a couple minutes a day, that's not going to get you, a chiseled jawline and a good-looking chin, and your cheekbones to pop out. You're not going to get that result with this. So instead of hitting your face with a hammer all day long and creating bruising and people asking you if you got beat up, right? I think the better kind of long-term solution would be to invest or looking into kind of like an energy-based device. One of the devices that I ran across lately is called the Wonder Face device. And it actually combines electromagnetic energy along with radio frequency to really help build up some of the muscles in our face. And that can create more longer lasting effects. It can create lifting and also can create slimming, especially in the under jaw and kind of neck area. So go ahead and look into that if you have any time.
Okay, this last one, I don't think I need to show you a whole video about it. Toothpaste on pimples, does it work, does it not?
So yeah, I mean, toothpaste on pimples, it depends on what the paste is, but really what you're relying on is the kind of drying out effect of the toothpaste on the pimples. Sometimes toothpaste, and I don't know if some toothpaste has some type of peroxides, those can maybe have like a antibacterial effect, right? This is something where when we're teenagers, we try everything, right? And we're like, oh, we have this, and there's tons of it, and it doesn't hurt typically, but it basically does is it just kind of helps dry out your pimples.
Can it cause like acne scarring or any type of like burning?
Oh yeah, I mean, I guess if you use it excessively, it probably could maybe cause some type of micro trauma, but in terms of overall scarring, likely not. A lot of times scarring is if the acne is so bad that it's not healing properly, or if you pick, right? So if you're popping your pimples or being too aggressive that way, or using your nails, right? Then you can actually cause physical trauma to the skin and cause long-term scarring. So one of the key takeaways with TikTok trends or social media is take it with a grain of salt, right? And you don't need me to tell you, but you always have to think about what you're seeing. It's not always, you can't always believe what you see, right? Do your research, right? Consult your medical professional. And if you've enjoyed the session and like what you heard, go ahead and follow me. My name is Dr. Jin, and go ahead and hit that like button.
Great.